Thanks for tuning into the Maine Challenge this week. What's up this week is talking about COVID-19, the pandemic, how it started, how it's going, and how we're going to get through it. We had a chance to talk to some folks from the CDC about the latest information on vaccines and where we are and the statistics in Maine. We talked to mental health professionals about what it's like for all of us in terms of stress and anxiety and some places and some resources to help. And we talked to a kindergarten teacher to find out how she's doing with her littles as they work to get through the pandemic and she works to teach during this pandemic. Lastly, I get to sound off about dating men. Well, actually on mandates and what I think about them for vaccines, for masks, and for our communities. Please stay with us. We hope you enjoy.
Do you think that there should be a mask mandate?
That's a tough question.
Yes.
Yeah.
Yes.
Okay.
I think that it should be based on science, and if COVID rates rise above a certain level, then there should be.
So thank you so much for being with us. And today I'm really excited and happy to have with us Lindsey Hamis, who is the Director of Vaccine Communications for the CDC here in Maine, and a very busy job. And I know you have lots on your plate. So I really appreciate you taking some time to be with us. Thanks so much.
Very happy to be here. Thanks for having me on.
Great. I know that this week has been, there's a lot of information out there. Here's the part that is hard for people. So Maine is doing a great job in terms of high vaccination rates. We are getting lots of folks vaccinated. We're, pretty high compliance rate, I think, with, social distancing and masking. And yet we still have one of the highest hospitalization rates and transmission rates in the country. So how can both of those things be true? I think that's where people are. It's like, wait a minute, how is this possible?
Yeah, I think, like you said, we're at a place that's it's great because we're one of the most vaccinated states in the country and one of the most vaccinated countries in the world. And in total, 907,255 total Mainers have been vaccinated, fully vaccinated, of our entire population. That's according to the US CDC data as of Monday, the 20th. That's great news, right? But there are still more of us out here, Mainers, who are not vaccinated, and it's sort of creating a bit of a picture of two Maines. And so, I guess what I would say here is for those who are unvaccinated, the Delta variant is just, it's a bear, right? It's hard to put too fine a point on how dangerous this is, how transmissible it is, how kind of wily and
severe,
exactly, how it will latch onto sort of any available opportunity to infect. And so we're seeing rates of community transmission across Maine and across the country that are making people sicker and ultimately landing people in the hospitals and then in ICUs, on ventilators. And you're right, we're at a point where we're hitting records that nobody wants to be hitting, unfortunately.
Yeah. So I think, so for so many people, it was, at first we were worried, and like the first wave, if we can call it a wave, we were worried and sort of almost scared into submission. And I think people felt like, okay, now, we're gonna do all the things right, and we're gonna, do it, and then summer. And now I think people we're facing the winter, and potentially, more isolation and more, being really careful and stuff. And so we did some talking to people on the streets, and I'm happy to say that most of the people we talked to, I think almost everybody we talked to, and they were random, supported the wearing masks, supported vaccinations, did all of that. But there was one gentleman who worried that he said, I'm vaccinated.
I think if you're vaccinated and you can show proof of vaccination, that you shouldn't have to be obligated to wear a mask. I went to a school conference last night, and they required masks, and I kind of felt like I didn't want to wear one, but I was forced to wear one, and I didn't want to wear it.
So what would you say to that?
Yeah, I guess I would say, I know it's frustrating, And we know that kind of at the beginning of the summer, everybody heard get vaccinated and this is your opportunity to throw the masks away. And I guess I would come back to the Delta variant. The Delta variant has changed everything, unfortunately. And what I will say is that being vaccinated still means that you are at just such an exponentially smaller risk of becoming infected with COVID. And so you are safer in that sense. And we thank you for getting tested, and we thank you for wearing masks and things. At the moment, Maine doesn't at the state level have a mask mandate in place. So mask mandates are, the purview of local businesses and schools. Of course, our strong recommendation, particularly in schools, is that everybody wears a mask no matter what, no matter when, no matter what your vaccination status. But and the recommendation from the US CDC and our guidelines that we're sort of following, their guidelines that we're following, are also that if you're out about in public in an indoor place, we also recommend that you wear a mask for your safety and for others. But we know that the virus spreads more easily inside, and that's why we ask just to use every sort of tool that we have in our tool belt to try and protect yourself and others who either may not yet be vaccinated or who can't yet be vaccinated, right? Thinking of kids who aren't yet eligible.
Wow. Well, and I think that's what I feel is like, you're not doing this for you, you're doing this for other people. So, let's talk a little bit about other variants. So now, of course, on the news and in the COVID world, we're hearing about new variants. And so talk a little bit, Lindsey, about how that happens and why having more vaccinated people helps us resist new variants.
Sure, I'm happy to talk about that. I will preface this by saying I am not an epidemiologist. I'm not a scientist. I'm a communications professional. But what we know there is that, by being vaccinated, you're sort of putting up your wall of defense. And it means that the virus can't take hold, mutate, and then move on to somebody else. Or if it does take hold, it doesn't have a good foothold, if you will. And so you're making it harder and harder for the for the virus to find a way to change, evolve, mutate, become something different. I will say at this point, across the nation and according to our sort of genome sequencing, we're still seeing that the Delta variant is responsible for about 99% of the virus that we're seeing, certainly in Maine, but across the country at the moment. There are other variants that the media are talking about. I think we've heard about the Mu variant and the Lambda variant, and there could be others as well in the future. But by getting vaccinated, you're sort of putting up you're putting a roadblock in the way of transmission. And so the more people that we have vaccinated, the greater number of roadblocks. And eventually, the idea is that if more people are vaccinated, the virus doesn't have anywhere to go where it can then mutate and turn into something that we, don't know how to protect ourselves from.
So let's talk a minute about the vaccination for kids. How optimistic are you that we're going to have access to it and that Maine kids are going to get access to it? How are you feeling about that? And in news you can tell us?
I wish I did have news I could share. I don't, we're waiting from the federal authorities. Obviously, we know that Pfizer has just given their data to the FDA. And so it will take them, I think it's typically 5 to 10 weeks, maybe a little bit longer even potentially, to do the scientific review that's needed for that, to make sure that the vaccines are safe for kids and the dose that's been given, that they are effective at preventing or helping to prevent disease. And so we're waiting for the science to tell us what to do on that front. And, the Moderna vaccine will be, I assume, shortly sort of on the heels of Pfizer and J&J there again after that. We are eagerly awaiting those results as soon as the FDA and the US CDC have their sort of ducks in a row and feel comfortable. They'll make their recommendations. When that happens, Maine CDC is, ready to run. We are confident that there will be vaccine in the state for kids. We're working already with providers and, pharmacies and provider offices and pediatricians to make sure that we're getting a plan in place so that when that ruling comes down, that it is safe and effective for children, and we expect that it will, that we're ready to start vaccinating right away.
All right, that's very welcome news. So reading about what's going on in Europe, and again, in the attempt to help us get back to normal, we are relying a lot on a lot of the instant tests, the antigen tests, that you can buy in a drugstore, and the government has subsidized those so that, as I understand it, you can correct me if I'm wrong, that tells you if you're contagious at that moment.
Yeah, so I think we definitely have antigen testing here in Maine. For a while, it was sort of the testing that's been most broadly available, and we were working to make sure that continues across the state. There is a nationwide shortage of materials for those tests, and so we are impacted by that, just as the rest of the states are. But we do find that is a helpful tool to be able to, within, usually the results come back within 15 minutes or a couple hours, depending. But that is a helpful tool to make sure that people are safe and able to go about their days and engaging in activities that they would normally engage in. I would say that they are not always 100%. And so that's why we ask also, certainly people to get vaccinated if they haven't been vaccinated, but also to wear masks if they're going into public places or if they're going to be interacting with vulnerable populations in particular. And then there's always, the hand washing and distancing, which are never bad public health measures.
Good for everything. Yeah. Oh, good. Awesome. Okay. So the last question I have for you, Lindsey, is if there's one thing that you would want people to know from the CDC at this moment.
That I know everybody had hoped at this point that we were going to be through this, and we're as bummed out as everybody, but we're also working really hard to make sure that we can make Maine people safe. And so do the things that you can do to keep yourself safe, to keep your family safe, to keep your friends, your kids, your loved ones, your community safe. And that is get vaccinated if you haven't been vaccinated, or if you're able to have a conversation with someone who's close to you. We're not going to argue our way out of this pandemic, but having conversations and listening to people's concerns and sharing your experiences, I think, can be a useful tool to move people who are still perhaps hesitant along the spectrum. And the more that we can get Mainers vaccinated, the sooner we will be through this.
Awesome. Well, thank you so much. Thank you for being with us today, Lindsey. And again, thank you so much for the work that you do every single day. And everybody at the CDC, we know you are working overtime. And as hard as this is for all of us, I can't imagine what it's like for all of you. So thank you for what you're doing for me. We appreciate you.
Thank you, Betsy. And thank you for all you're doing to bring this information to Maine people.
I think there's a substantial amount of evidence that says masks work, and so a mask mandate I'm all for.
Do you think there should be a mask mandate?
At this moment?
Yes.
Yeah, for sure. Yeah, I think so. Yeah.
Mandate? No.
So today I am so happy to have with us Ken Olson, who has been the executive director of Kids Peace for a long time, recently retired, and Joe Everett, who is the CEO at Opportunity Alliance. Both agencies do incredible work around mental health, Kids Peace for kids, Opportunity Alliance for both children and adults. So we are in a really tough time. I think, now here we are in the fall. I think most people felt like, okay, we got through COVID last spring and summer, and now, we're having more COVID cases, more people in the hospital than ever before. And we talk a lot about the physical effects and what's happening to people physically. Let's talk for a minute about what's happening to people's mental health, because I think it's affecting everybody, right? What are you seeing? Are you seeing it in your clients? Are you seeing it in your friends? What do you think's going on?
Absolutely. I think that it's just continuing to get more intense for people. I think folks are still struggling with isolation, like you sort of mentioned, that we thought would be at the end or hope to be at the end. So I think that people that we're supporting are very isolated, scared. I mentioned earlier that, people are very afraid now that children are being infected. So parents with children, people who work with children are now concerned about the well-being of children and young adults or adolescents. So I think that's become more scary. And I think just, again, not having an end in sight is very hard for folks. So increased symptoms of depression. I would also add, we're hearing a lot more about increased substance use. increased alcohol use, marijuana use, maybe even other drugs. So I think it's really taking its toll on our mental health.
And overdoses. I mean, we're seeing a lot more
increased
overdoses. Yeah.
Absolutely.
Yeah. And what do you think about for kids themselves? I know the parents, it's very stressful. What do you think about kids?
Well, I think if you're a parent, you know what kind of stress COVID has brought to your kids and to your family, and that there's hardly an aspect of child development that has not been adversely affected by this pandemic. Whether it's the mom of a 2 or 3 year old who is struggling to meet their kids' needs and their family's needs, or whether it's the kid who would normally be in school but doesn't know if they're going to school today or tomorrow because maybe there's some contact tracing that requires them to quarantine, or the school's closed, or you're a teenager. And if you're a parent of a teenager, you know that whether your kid plays clarinet or plays on the football team, that their mental health is affected by this pandemic. And parents are understandably really concerned about what that means. And I think as a profession, I think it's going to be a while before we really understand that. I mean, we know a lot about kids and the impact of adverse childhood experiences, which is to say different kinds of stressors that come to kids. And we know that the antidote to that are protective factors that kids have. And those protective factors include things like playing on the football team.
Playing the
clarinet. And we know the degree to which those things have been disrupted by the pandemic. And I'm sorry, I don't think there's one of us that can say honestly that the pandemic has not raised our stress levels about how we are as parents and how we are as families.
Yeah. If there's one thing that you would like people to know, or you would like people to be aware of, what would that be in terms of mental health, in terms of people, not just in general, but in terms of people's mental health, in terms of the mental health system, in terms of what we're going to need going forward? Do you have a thing that you would want people to know?
Well, I really want people to know that there are resources available like the Maine Crisis Line and like 211 Maine, where they can contact. People are not alone, and they can call. It's free. They can call repeatedly to get their needs met, and people are not alone. So that's really important to me, that people don't sort of begin to believe that there's no hope or there's nothing out there for them. So I think, and we are seeing definitely increased call volume in those two programs, but I think sort of holding on to hope is really important to me.
Yeah, and along the same kind of lines, I think that it's back to your kind of point about the stigma associated with this, is that I want people to know that what they're experiencing in terms of their increased levels of stress and how that is impacting their relationships with people. This is happening to all of us.
Yes.
This is not something that is in some way like unique to you, that you need to be like super private or embarrassed about. This is what is happening to all of us.
Yes.
And the degree to which we understand that it is happening to all of us, and it's happening to me, and maybe the fight that I just had with my wife is about the fact that I'm more stressed than I am usually. Those kinds of things, I think if people come to understand that and understand that there are resources there to help them manage this level of stress that's been increased for all of us, is particularly important.
Right. And it's not a personal failing.
Right.
This is something that we're all experiencing. And that's my intention, is that I really want us to address this as a community, right? This is not, we're so individualistic, I think, in so many things. And this is a community issue, a state issue, a national issue, a global issue, and we're going to solve it globally. Yeah. Well, thanks so much. And thank you so much for the work that you do every single day.
So I'm with Terry Pelletier today, who is a beloved kindergarten teacher, and I know kids in their 20s and 30s who still talk about their beloved kindergarten teacher, Terry. So mostly, Terry, I can't imagine. I mean, I know teaching is always a hard thing to do. I can't imagine what it's been like the last 2 years for you, especially with kindergartners. So just tell us, how's it going?
So we just had to really think outside the box and restructure everything. Because kindergarten's a lot about social skills, learning to play. So we had to take all our things and put them, we went to Home Depot and got individual buckets so the kids could still have the experience of doing a lot of hands-on things. But they had to do a lot of parallel play
with their own
because they were 3 feet apart. But you know what? Kids are resilient at this. I've got the little kids, and they did it, and they were just so happy to be in school.
Oh, I bet after being home.
Yes, after being home, and really the masks.
That
that's
was my
their
question.
That's their world now, and so I never have to argue with anybody to keep it on. I think that's when being little is easier. I don't know about the older kids. It's a little bit different.
Yeah, they have an opinion.
Exactly. But the kindergarten, first, second, really the elementary kids are really good about it. They just want to be with their friends at school.
Right. So they feel like that's more important.
Exactly.
Yeah, right. And
this year, what's great about this year is that we're here 5 days.
Okay, so the kids can be here for the whole week.
For the whole week. We still have the mask mandate, which I'm thankful that the board voted for.
Yeah.
It was 5 to 7 to keep the masks. We keep 3 feet apart. I bring my class out every day for snacks.
Yeah.
Last year, we made it all the way to Thanksgiving. And then I realized when the little girl opened her fruit roll-up and she took a bite of something else and then she picked up the fruit roll-up, it had frozen in a straight line. Because I'm like, we're not
in the envelope.
We're not eating inside. I don't need that stuff. So then right after Thanksgiving it snowed and then it was too hard to snack outside. But we, I spread them out all over the
you guys created an outdoor classroom, right?
Yes.
In the woods? On my walk, I see.
Yes, we're very fortunate. Our PTO has an extensive outdoor education program that they've developed. We have 2 classrooms. We have trails that they work on. We have the lovely garden.
Gorgeous
the kids,
garden.
My kids came out 2 weeks ago and picked carrots and ate some of the tomatoes on the plant. So that's really a big thing that's made it be okay to have all this outdoor space. The principal's awesome. She rented a tent, so if it's raining or if it's super hot, we can go under the tent. So the kids are really they're they do well, and it'll slip down a little bit. I don't remember to put it over your nose, and they just pop it back up. So the older kids, I'm sure maybe it's more difficult. I don't know because you do get a lot of social cues and things from your facial expressions.
Yes, right. Yeah,
so.
that must be hard because you can sort of read kids, and it's amazing we've gotten really good at reading eyes.
Yes, I know. Usually it's your teacher face, but now it's like the eyes that they have to learn to read. So.
Yeah. And how about parents? Have parents been pretty much supportive and helpful?
Yeah, they are. We used to say to pack a couple masks, put them in the backpack, and they do that. I know that some parents. I think it's kind of this way in the world. Some parents feel strongly about not having masks, but I just actually had a conversation with my 5-year-olds today. So do you know why we wear masks? And so we talked about that, and I'm honest with them. It's like I said, do you guys like wearing a mask? And they're like, no. I'm like, I don't really
we don't
either. I said,
but
but
true, right?
I am so happy to be in school for 5 days. I said that's how we're able to stay in school and be in school for 5 days.
Yeah.
So that's they you kind of just have to bring it to their level.
Yeah.
So
That's awesome.
Yeah.
Well, so you said that kids are resilient, but I just want to say the teachers are the heroines and the heroes because you guys are miracle workers and making this work. And I my kids are out of school now, but I know that every single parent is so grateful for thank you for all that you do. Kids are lucky to have you.
Thank you, Betsy.
Thank you. Thanks so much.
And what do you think about a vaccine mandate?
A vaccine mandate, yeah, same, absolutely.
I'm in favor of it. I mean, we have it for children to go to school. They have to prove vaccination for mumps and measles. So I don't think we need to be afraid of vaccines. It's become such a political issue, and the spillover from the Trump years. It's really sad. It's a place I never thought I'd see my country in.
So lately, all we hear on the news and all people talk about these days are mandates. Vaccine mandates, mask mandates,
And some people are really thankful for them, and a lot of people are really mad about them. So as I think about it, I think that mandate is a word that has become weaponized and really used when people want to get a rise out of people instead of using the word law. Because really, isn't that what a mandate is? It's a law. Now, we have a law that says when there's a red light, we have to stop our cars. Is that a mandate? Yeah, kind of. But it's really important because otherwise there'd be all kinds of accidents. When you work on a construction site, there's a regulation, not a law, that you wear a hard hat and steel-toed boots. Is that a mandate? Well, you don't have to do it, but if you don't do it, then you can't work at that site. That's what's going on with vaccines and masks here. There is no mask mandate in Maine. It's up to individual businesses and schools. And there is no right now a vaccine mandate generally, just for certain categories of people. So basically, this is a law that says, how can we help stop the spread of this deadly, now over 1,000 deaths, disease? So we can have lots of conversation and fights about the political nature of this and why it's become so political and it's become a political football. I don't think polio was that kind of, we didn't have that kind of conversation. We did have that conversation around drunk driving. And we did have that conversation around seatbelts, right? People were so mad that we were infringing on people's rights. But when push comes to shove, these mandates are not about you. They are about other people. And that is the thing that makes me the saddest and the most passionate about this. I don't wear a mask for me. I'm vaccinated. I'm pretty sure that even if I get COVID, I'm not going to be in the hospital and I'm not going to die. I wear a mask in indoor places and I do all the social distancing and everything for other people, for members of my community, for little kids who can't be vaccinated, for elderly people or for people with cancer or people who are undergoing chemotherapy who can't, for whatever medical reason, get vaccinated. That's why I wear a mask. So it just makes me think, it makes me really sad about how our communities have really become so torn apart and so dissolved that we aren't willing to do the simplest of things, like wearing a mask to make sure that everybody in our community is okay. Because that's what it's really about. It's not really about you. It's not really about an individual thing, and it's certainly not about individual freedom. It is really about how do we care for one another, how do we show that we care for one another in our communities, and how do we make sure that we get a handle on this disease that has so upended all of our lives. So get vaccinated if you're not. Wear a mask, wash your hands, stay socially distanced, and know that you are doing this for the good of your community. That's how we're going to start to build back our communities and stay connected. We can do this.